If you're over 60, there's one thing you do every single night that could quietly push your brain toward a stroke. No warning, no chest pain, no dizziness to wake you up, just the cruel reality that you go to bed feeling fine, and by morning you may not be able to speak, stand, or recognize the face of the person sleeping next to you. As a brain doctor who has treated stroke patients for more than 30 years in hospitals across the United States and Canada, I can tell you this. The most devastating strokes I've seen didn't come from smoking junk food or neglect. They came from small, harmless habits in the way people sleep, habits most seniors never question. Tonight, I want to walk you through the hidden dangers of 9 common sleeping positions and bedtime routines. These are the habits that seem cozy, familiar, even safe, but in reality, they can silently increase your risk of brain bleeds, clots, or sudden pressure spikes while you're asleep. And the truth is, most of these strokes are preventable. So, let me ask you this. When you lay down at night, do you think about how your body is positioned? Do you ever wonder if the way you sleep could be stealing years of independence from you? Stay with me, because what I'm about to share might be the most important health lesson you hear this year. And if you care about protecting your memory, your words, and your family's future, hit that follow button and let's share this journey together. It looks innocent, even comfortable. Lying flat on your back, arms at your side, no pillow beneath your head. Many seniors I've spoken with in Michigan, Ontario, and across North America tell me, "Doc, that's how I've slept for decades. It eases my back." But here's what almost no one tells you. At age 60 and beyond, sleeping this way can quietly set the stage for a stroke. Here's why. When you lie flat, your head is at the same level as your heart. That means the veins that drain blood out of your brain must fight against gravity. In younger years, your vessels are elastic, flexible, and able to adapt. But after 60, those vessels stiffen. Blood slows down. Instead of draining smoothly, it pools, thickens, and sometimes clots. And when morning comes, when blood pressure naturally spikes, that clot can travel straight into your brain. I'll never forget Leonard, a 7-year-old retired mechanic from Michigan. He slept flat every night, hands folded on his chest, a habit from his Navy days. One morning, his wife found him awake, but unable to speak, his right arm limp. The scan showed a clot in his middle cerebral artery, a stroke that stole his independence in a single night. He told me later, "Doc, I thought I was resting better. I didn't know I was gambling with my life." This isn't about comfort, it's about circulation. Sleeping flat is especially dangerous if you also have high blood pressure, sleep apnea, or if you take medications that lower your pressure too much overnight. The simple fix: elevate your head by about 30 degrees. Use 1 or 2 supportive pillows that keep your neck aligned, not bent forward. This small change can mean the difference between waking up refreshed or never being able to speak your grandchild's name again. So let me ask you tonight, when you lie down, will you choose comfort or protection? Comment below if you've ever slept flat without a pillow, and let's talk about safer options together. There's another habit that looks harmless, but can quietly put enormous pressure on the brain: sleeping face down with your head twisted to one side. Many older adults tell me they've done this for years because it eases back pain or makes them feel cocooned, safe, like wrapping themselves in a blanket of comfort. But what feels cozy to the body can be deeply dangerous to the brain. When you sleep face down, your neck must rotate sharply so you can breathe. That twist compresses the vertebral arteries, small but critical vessels that carry oxygen-rich blood to the back of your brain. This region controls balance, coordination, and even your consciousness. At the same time, pressure builds on the carotid arteries as your face sinks into a pillow or mattress. Instead of blood flowing smoothly, it slows, pools, and thickens. And in those long nighttime hours, thick blood can quietly form clots. By early morning, when blood pressure naturally rises, those clots may break loose, travel, and trigger a stroke before you even open your eyes. I once treated Ethel, an 82-year-old retired schoolteacher from Ohio. She had always slept on her stomach. One morning, her daughter found her half-conscious, her words slurred, her left side unresponsive. The scans revealed a stroke in her cerebellum, the part of the brain that governs coordination. She hadn't skipped medication, she didn't smoke, and she wasn't diabetic. The only culprit was the years she spent face down in bed, unknowingly starving her brain of blood flow. Ethel survived, but she now needs a walker and struggles with daily independence. The danger grows higher if you also have sleep apnea, snore heavily, or use sedatives. In those cases, your body reacts slower to oxygen drops. A younger person might jolt awake when airways close. At 70 or 80, the same oxygen dip may pass silently, setting up the perfect storm. Changing this habit is not about comfort, it's about survival. Switching from stomach sleeping to side sleeping, preferably on the left, with a supportive pillow to keep your head aligned, can restore safer circulation overnight. Small adjustments like these protect not just your rest, but your ability to wake up in the morning with your speech, your balance, and your independence intact. There is also a quieter, almost childlike habit that many seniors carry into old age: pulling the blanket up over the head. It feels warm, safe, and familiar, especially on cold nights. For decades, it may have seemed harmless, even comforting. But once again, what feels protective can in reality be quietly dangerous. When you cover your head with a heavy blanket, you limit airflow around your nose and mouth. As the night goes on, oxygen levels inside that tiny cocoon drop, while carbon dioxide steadily builds. A younger body may tolerate this imbalance, but after 60, the brain becomes less resilient. Low oxygen and high carbon dioxide levels thicken the blood and strain fragile arteries. Add the natural dehydration that comes with sleep, and suddenly, you have the perfect conditions for clot formation. I remember Richard, an 81-year-old retired postmaster from Iowa. Since childhood, he had pulled the covers over his head, telling his wife it made him feel at peace. One winter morning, she found him groggy, barely able to open his eyes. In the hospital, scans confirmed he had suffered a silent stroke during the night. Not from clogged arteries or atrial fibrillation, but from restricted airflow and oxygen deprivation under a quilt he thought was harmless. The science explains why. During deep sleep, especially REM cycles, the brain needs steady oxygen to repair clear waste and stabilize blood pressure. When airflow is cut off, oxygen drops, the heart races to compensate, and blood pressure fluctuates wildly. In older adults with stiffened vessels, those fluctuations become dangerous. A clot can form silently, and by morning leave permanent damage to speech, memory, or mobility. The solution is simple but essential. Avoid covering your head completely. Instead, use breathable, lightweight bedding. Keep the room comfortably warm, but not stifling. If light or noise bothers you, choose a sleep mask or earplugs rather than burying yourself under layers. These small adjustments may seem trivial, but they allow your brain to breathe freely through the night. What we don't know can hurt us, especially in sleep. And Richard's story is a reminder that even habits born from comfort can, with age, turn into hidden risks. Recognizing and correcting them is not about losing comfort. It's about preserving independence and protecting the brain from silent strokes that so often strike in the quiet hours of night. Another habit that seems practical, even necessary for many seniors, is sleeping in a recliner. Back pain, stiff joints, acid reflux, or shortness of breath often drive older adults away from their beds and into a chair that feels supportive. At first, it seems like a solution. The recliner cushions the body, angles the spine, and provides relief. But night after night, what feels secure may quietly turn into a trap for the brain. When the body rests upright at a 45 or 60-degree angle, gravity begins to work against circulation. Blood is pulled downward away from the brain, and major veins in the legs and hips are compressed. Instead of flowing freely, blood moves sluggishly, pooling in the lower limbs. For someone under 40, this may not mean much. But for those over 60, when blood has already thickened with age, vessels have narrowed and the heart pumps less efficiently. Slow-moving blood becomes fertile ground for clots. Barbara, a 79-year-old retired florist from Kentucky, is one patient I'll never forget. After hip surgery, lying flat in bed was too painful. She told herself the recliner would be temporary. 5 years later, it had become her nightly bed. One morning, her daughter found her still in the chair, confused, unable to move her left hand. The scan showed a small stroke deep within her brain. No warning, no pain, no obvious risk factor beyond years of poor circulation caused by sleeping upright. This position also disrupts the body's bare reflex, the natural system that balances blood pressure between the heart and brain. In flat sleep, this reflex keeps circulation stable. Upright, it weakens, allowing blood pressure to fluctuate dangerously. Add in dehydration medications or tight socks, and the risks multiply. The safer alternative is not to abandon elevation entirely, but to use it wisely. Adjustable beds or wedge pillows can lift the torso without compressing the legs. Regularly stretching and moving the lower limbs before and after sleep also helps keep circulation alive. Barbara now sleeps in bed again, head slightly raised, hip supported by a body pillow, and her recovery, though slow, is a living lesson. Comfort in the wrong form can quietly endanger life. There is a position that feels natural to millions of older adults, lying on the right side, tucking a pillow under the head, and slipping an arm beneath for support. It offers a sense of security, the familiar comfort of decades of habit. Yet beneath that comfort lies a dangerous reality. When the weight of the body presses down on the neck and shoulder, in this position, critical blood vessels are silently compressed. The carotid artery and subclavian artery highways carrying blood to and from the brain are narrowed for hours. Instead of flowing freely, blood slows, pools, and thickens. And in the stillness of night, thickened blood can quietly form clots. The risk doesn't stop with circulation. Nerves running through the shoulder, the brachial plexus, are also squeezed under the weight of the head and body. What begins as numbness in the arm may over time signal deeper microvascular damage. With age, when vessels stiffen and blood recovery slows, these small insults accumulate until one night they break into catastrophe. Ellis, a 75-year-old Vietnam veteran from North Carolina, knew this all too well. For decades he had slept the same way, right side down, arm curled under his pillow. It was the habit of a soldier turned into the rhythm of his later years. One morning his wife found him dazed, unable to move his left leg. The hospital scans revealed a clot in his middle cerebral artery. He was not diabetic, he did not smoke, and his cholesterol was under control. The only explanation was the silent nightly pressure on his arteries that finally betrayed him. Ellis survived, but now walks with a brace and relies on weekly therapy just to regain balance. The lesson is simple but urgent. What feels comfortable is not always safe, especially as the body ages. Shifting to the left side, using a supportive pillow that keeps the neck in alignment, and keeping arms free instead of pinned beneath the head, can protect circulation and reduce the silent strain on fragile vessels. These changes may seem small, but they are choices that safeguard memory, speech, and independence. Because while sleep is meant to restore, the wrong position can take away everything we value by morning. Restless sleep often creeps in with age, and many seniors dismiss it as nothing more than arthritis, an overactive bladder, or just getting old. But constant tossing and turning through the night is not just a nuisance. It can be a red flag from the brain itself. Every sharp roll in bed, every shift of the neck or torso temporarily alters blood flow. In a healthy young adult, vessels adjust quickly and circulation returns to normal. In a 70 or 80-year-old body, where arteries are stiffened and veins narrowed, each interruption can become a subtle insult to the brain's delicate network. Nancy, a 76-year-old retired piano teacher from Colorado, taught me this lesson vividly. For months, she complained of waking up exhausted, despite sleeping 7 hours. Her husband noticed she fidgeted constantly in bed, shifting side to side every few minutes. They thought little of it, until one night, Nancy woke up unable to form words, her right hand numb. Scans revealed a small ischemic stroke. A sleep study later confirmed the truth. Her restless movements caused intermittent hypoperfusion, meaning her brain was being deprived of steady blood flow night after night. What looked like harmless restlessness was in fact starving her brain. Restless sleep also prevents the natural drop in blood pressure that should occur in deep rest. Instead, pressure fluctuates, placing stress on fragile arteries. Cortisol, the stress hormone, remains elevated, making the heart beat harder when it should be resting. Over time, this cycle creates inflammation in the brain's vessels, increasing stroke risk silently. The warning signs are often subtle: waking drenched in sweat, morning headaches, a stiff neck, or tingling in the hands. These are not just inconveniences of age, they may be the body's quiet plea for help. Addressing them means treating restlessness as a symptom, not a habit. Avoiding late caffeine or alcohol, keeping the room cool but not cold, using layered bedding instead of heavy sheets, and supporting the body with a pillow to reduce unconscious jerking can all stabilize sleep. Rest is meant to heal, but fragmented rest can betray. For seniors especially, quality matters more than quantity. Each peaceful hour of stable sleep is not just comfort, it is protection for memory, speech, and the ability to rise in the morning with strength intact. Among the most overlooked dangers for older adults is something that doesn't happen during sleep itself, but right before forgetting or intentionally skipping a dose of blood pressure or heart medication. For many, taking pills becomes such a routine that one missed dose feels harmless, almost insignificant. Yet in the aging body, that single lapse can set the stage for disaster in the silent hours of the night. Blood pressure follows a natural rhythm, rising in the early morning and dipping at night. Medications help control these shifts, easing the strain on arteries and stabilizing the heart's rhythm. But when a dose is missed, the protective shield is lifted. During the overnight hours, blood pressure can spike sharply, sometimes between 2 and 6 a.m., exactly when most strokes occur. The heart may beat irregularly, the blood may thicken, and fragile vessels may suddenly face pressures they can no longer withstand. Harold, a 72-year-old retired electrician from Wisconsin, illustrates this truth. He lived carefully, ate sensibly, walked daily, never smoked. His only condition was mild hypertension, controlled with one pill at night. One evening, distracted by a ball game, he forgot it. "I'll take it in the morning," he thought. But morning came with slurred words and a face that would not obey. A clot had formed overnight and lodged in his brain, causing a moderate stroke that stole much of his speech. Harold survived, but he told me later with tears in his eyes, "One forgotten pill cost me my words. I won't let it cost me anything else." The physiology is straightforward. Without medication, pressure builds, irritating artery walls and activating platelets that form clots. In younger bodies, resilience might cover the mistake. In older adults, where arteries are stiff and recovery is slow, the margin for error is razor thin. That's why consistency is everything. Taking medication at the same time each evening, using pill organizers, setting alarms, or asking a loved one to check in can transform a fragile routine into a life-saving habit. Skipping a dose may feel trivial, but in truth, it can mean the difference between a peaceful night and a morning forever changed. Another silent but underestimated risk comes not only from how you position your body, but also from the environment you sleep in. Many older adults in the United States and Canada love the feeling of a cool bedroom, believing that crisp air leads to deeper rest, or they keep a window cracked even on winter nights out of habit. Others, seeking comfort, pile on heavy blankets and turn the thermostat high, creating a hot, stuffy room. At first glance, both practices seem harmless. Yet for an aging brain, sleeping in extremes of temperature, cold or overheated, combined with poor neck support, can quietly set the stage for a stroke. Cold air tightens blood vessels through vasoconstriction. When this narrowing happens in the neck, where the carotid and vertebral arteries carry vital oxygen to the brain, blood flow is restricted. Add to this the natural stiffening of vessels that comes with age, and circulation slows even more. A bent or poorly supported neck worsens the problem, pinching the very vessels that are already constricted by the cold. Over time, stagnant blood can pool, clot, and become a ticking time bomb waiting for the early morning blood pressure surge. On the opposite side, overheated rooms pose their own hidden threat. Excessive warmth leads to sweating and dehydration, thickening the blood while you sleep. The heart must work harder to circulate, yet the brain receives less oxygenated flow. If the head is poorly aligned, chin tucked into the chest or tilted at an awkward angle, the risk multiplies. Dehydrated, sluggish blood meeting compressed arteries is a recipe for clots that form silently during the night. Loretta, a 7-8-year-old retired nurse from Montana, lived with this danger for years without realizing it. She loved sleeping with her window cracked open, even in January. Curled tightly on a flat pillow, her chin pressed toward her chest, she would drift off believing she was breathing fresher, healthier air. One morning her son found her, disoriented, her speech slurred, her eyes unfocused. The hospital confirmed a brainstem stroke, caused by reduced blood flow through the vertebral arteries. No smoking, no skipped medication, just years of cold-induced vessel tightening and chronic neck compression. The solution is not to give up comfort, but to balance it. Aim for a bedroom temperature of 65 to 70 degrees Fahrenheit, 18-21 degrees Celsius, stable enough to prevent dangerous extremes. Support the neck with a medium firm pillow that aligns the head with the spine, avoiding positions where the chin tucks sharply into the chest or tilts to the side. Hydrate before sleep, especially in winter when the air is dry and the body loses moisture overnight. For those sensitive to light or noise, add a sleep mask or earplugs instead of burying under heavy, suffocating blankets. What may feel like a simple choice, how warm or cool your room is, how high your pillow sits, can quietly decide whether your brain receives the circulation it desperately needs through the night. In younger years, the body adapts. Past 60, every small stress adds weight to fragile vessels. That's why adjusting the environment is as crucial as adjusting posture together. They can preserve not only rest, but speech, memory, and independence for years to come. There is one more nightly habit that often hides under the comforting routines of life. After 60, going to bed immediately after a large dinner or a glass of alcohol. Many seniors in the United States and Canada describe the same pattern, finishing supper, late sipping a glass of wine or bourbon to relax, then heading straight to bed. For decades, this ritual feels harmless, even healthy. Yet with age, what once soothed the body can quietly betray the brain. When you eat a heavy meal, especially one rich in fat, salt, or sugar, the digestive system demands more blood flow. Blood is redirected from the brain to the gut to break down food. In a younger body, vessels expand and adapt, maintaining balance. But past 60, arteries stiffen, circulation slows, and the brain is left more vulnerable to temporary drops in oxygen. Add alcohol to the equation, and the risk climbs higher. Alcohol first dilates vessels, making you feel flushed and drowsy. But as it metabolizes, vessels constrict suddenly, blood pressure surges, and the heart struggles to stabilize rhythm. For a brain already operating with narrowed arteries and thicker blood, these swings create the perfect environment for clot formation. Gerald, a 74-year-old retired farmer from Nebraska, lived this routine faithfully: dinner at 7, a glass of bourbon by 8, bed at 8:30. It felt comforting, a mark of discipline after years of hard work. But one winter night, after a particularly rich holiday meal, Gerald suffered a massive ischemic stroke in his sleep. His wife found him at dawn unresponsive. The doctors found no heart disease, no missed medication, no obvious trigger except the late meal, the alcohol, and the unstable circulation they caused. Gerald survived, but the stroke robbed him of his ability to speak, turning a simple ritual into a lifelong burden. The science behind his story is clear. Heavy digestion diverts blood away from the brain for hours. Alcohol dehydrates the body, thickens the blood, and destabilizes the heart's rhythm. Together they cause unstable circulation during the very hours between 2 a.m. and 6 a.m., when strokes most often strike. Instead of rest and repair, the brain faces turbulence, pressure swings, and oxygen deprivation. Avoiding this danger does not mean giving up comfort. It means respecting the body's limits at this stage of life. Finish dinner at least 2 to 3 hours before lying down. If you drink alcohol, do so earlier in the evening and keep it modest. Pair each drink with water to reduce dehydration. Choose lighter, balanced meals in the evening, avoiding the salty, greasy, or sugary foods that strain vessels. And never mistake alcohol-induced drowsiness for healthy sleep. What feels like rest may in fact be fragmented, leaving the brain unstable. Small changes in routine can carry immense weight. Shifting dinner earlier, replacing that nightcap with herbal tea, or keeping a glass of water at your bedside are choices that protect memory, balance, and independence. Because while food and drink bring joy at this stage of life, they must also bring awareness. Sleep should be a time of healing, not of hidden risk. And respecting that truth may be the difference between waking up whole or waking up changed forever. When we put all these lessons together, a clear truth emerges. Most strokes that strike in the quiet hours of night are not accidents, but consequences of routines we never questioned. Lying flat, without a pillow, sleeping, face down, pulling the blanket over your head, dozing in a recliner, curling on your right side, with your arm pinned, tossing and turning restlessly, skipping medication, sleeping in extreme temperatures, or going to bed right after a heavy meal and alcohol. Each of these habits may seem small, even comforting. But with age, small choices gather weight, and what once felt harmless can slowly push the brain toward disaster. The good news is that prevention is within reach. Elevating your head, supporting your neck, keeping your room at a safe temperature, honoring your medication schedule, avoiding heavy late meals, and choosing positions that let blood flow freely are not complicated medical procedures. They are small acts of awareness. For seniors in the United States, Canada, and beyond, these adjustments are not about giving up comfort. They are about redefining it so that rest restores rather than harms. At this stage of life, protecting independence, memory, and the ability to speak and move is worth more than any fleeting comfort. Each night is an opportunity either to strengthen your brain or to unknowingly place it at risk. By making wiser choices tonight, by honoring what your body truly needs, you safeguard tomorrow. Sleep is not just rest. It is survival. It is renewal. It is protection. And every senior has the power to shape it wisely.